Oh, welcome back, everybody. 365 days, nearly 600,000 cases, and 16,000 deaths since the coronavirus officially arrived here in the state of Michigan. We've come a long way, especially with what we've learned and continue to learn about this virus. Dr. McGeorge is here with the 4 things that we wish we knew back on day 1 and how that's going to help us as we move forward.
Researchers will be studying the coronavirus and how we responded to it for decades to come. But even now, it's crystal clear we overestimated our ability to control it and made some assumptions that turned out to be wrong. From the start, experts believed the SARS-CoV-2 virus would act much like the previous coronaviruses that caused SARS and MERS. One fact we wish we had known then, that people without symptoms could spread the virus. Experts now estimate about half of all COVID cases are spread by people who are asymptomatic or pre-symptomatic. That's important because we also know now how much masks matter. While at first they were only recommended for those who were sick, numerous studies have now shown well-fitting fabric masks can effectively prevent spread if we all wear them. That fact could have made a huge difference in those early days. Most experts also expected the virus to subside when the weather turned warm. Instead, there was a summer surge in many parts of the country.
I never would have predicted that we would have had as much transmission and serious disease going straight through the year as we had. I was thinking more in terms of what we see with flu, where at least when the weather warms up, we get a decrease in the number of cases.
Dr. Arnold Monto, a world-renowned epidemiologist at U of M's School of Public Health, called SARS-CoV-2 a weird virus. He says it just doesn't act the way the experts have predicted it would. Moving forward, that may be the most important fact of all.
Everybody who's tried to predict what's going to happen tomorrow with this virus has been wrong. And to really throw caution to the winds, to open everything up all of a sudden is not the way to go, because you want to do it gradually and see what the effects are.
There's a lot of wisdom in Dr. Monto's words. There is still so much to learn about this virus, and now its variants. Where are we going to be a year from now? Only time will tell. Back to you.